Welcome to the LMD Podiatry Podcast. Trust us to get back on your feet. Here's your host, Dr. Lauren DeBaccaroff.
Hello, everyone, and welcome back to another episode of the LMD Podiatry Podcast. I'm your co-host, Jeremy Wolf, joined by, of course, your host, Dr. Lauren DeBaccaroff. Dr.
Hey,
Lauren,
everybody.
good to see you again.
All
Good to
right.
see everyone back.
Yes.
So you told me before we started this today, you wanted to talk a little bit about fat pad rejuvenation.
Yes.
And
Go ahead.
I'd never heard that before, so I'm excited and interested to get into this topic. Why don't you kick off by talking a little bit about what fat pad rejuvenation is, I guess specifically for feet, because you're a podiatrist, and kind of how it helps alleviate foot pain. And then we'll go from there.
So there's a whole new science behind fat. So some people call it fat pad rejuvenation. Some people call it fat pad augmentation. But basically the bottoms of our feet, the soles of our feet, we have fat pads on the tips of our toes, like on the balls of our foot and on the heel. And basically we're born with those fat pads to give us shock absorption when we walk, to get a bounce back. Unfortunately, as we age, the collagen that holds all the fat together, it tends to become less elastic, tends to spread out. And then what happens to our nice cushiony fat pads, they start flattening out and moving around. And then a lot of people have pain in different, areas and joints or toes or heels, things like that.
Aside from age deterioration, are there any other factors that cause the deterioration in the fat pads?
It's really, I have seen younger people without fat in their foot, but that's usually from traumatic injuries and things like that. Like if they were in a car accident and then half of their foot was peeled off, but in like a regular, normal, healthy person, around the age of like 60, 65, that's when the fat pad starts dissipating. But there are cases like in younger people when if you don't have a straight foot and you have a pressure point in your foot, that would also contribute to pain and the fat pad moving around and creating pressure and pain in that area.
Who are the ideal candidates for this type of treatment in your experience? Like when you get somebody that comes in the office and you're looking at issues with the foot, like what are some common symptoms or struggles that people are having that would even lead you to pursue this type of therapy for them?
So the most common thing I see is patients with metatarsalgia. Metatarsalgia. So the long bones of your foot. Okay, the long bones of your foot. I think I have a foot picture here. No, wrong one. The long bones of the foot, a lot of pressure gets put on the ball of the patient's foot. And a lot of times because of, if you're a runner or if you're not wearing the right shoes and you pound your foot, a lot of times that fat pad kind of moves because it's just a regular wear and tear of the area. And then what happens is that fat pad, it just doesn't stay put anymore and it moves. And then all of a sudden people feel like they're walking on the joints or the balls of their foot. And you could actually feel like I can touch their joint on their foot and you could feel the joint and you don't feel any fat anymore. So really those areas, they have the fat pad atrophy and then they get the pain.
Makes sense. Walk me through, what does this procedure look like, right? How is this performed? Like I'm in my mind, I'm thinking like, what are you doing? Are you going in there with a needle injecting something, or
it's an injection.
Look like?
So I use a product called Leniva. I actually have like a really cool sheet that's blurring out here.
Yeah, we're getting a little blur over there.
I gotta get rid of the background. Let's see. Let me see here. None. Okay.
Yeah, throw that up there again. Let me see if I can see it. I don't know if the camera.
Okay.
There you go. That's a little bit clearer.
So for all the people watching on YouTube, so this is Leniva, and basically, I like this side. But basically, it's an injection. So it's the fat injection that I inject to the area that has fat pad loss, and it shows here over time how it goes from no fat in the area, and then it increases the fat cells in the area. And this is 12 weeks. It takes about 3 months for everything to regenerate.
3 months of treatment. Somebody.
It's really just one injection.
It's one injection. Okay.
One injection to the problem area, and then what happens is the body uses it's mixed. It's basically fat mixed with stem cells. That's what I like to call it. It's a fat mixed with stem cells. And what that does, it causes adipogenesis, which is basically it makes your body form more fat in the area. And it takes about 12 weeks to happen. Usually the first 2 weeks, the patients need to, keep off of that foot a little bit. I usually put them in a boot or put like a pad in like the specific area that I injected to offload it. But basically, it rejuvenates the fat pad in the sense that it makes your body create more fat only in that area. So Leniva is probably the most amazing product I've seen. I used to use other things for fat pad, augmentation like Juvederm and things like that, all these different products out of the market. But I found that they don't last. Patients that get this done, it's like one and done. Like they get it and they almost never come back again. Unless
that was going to be the next question.
Yeah.
What have you seen with patients? They can literally come in and get one injection, and it basically produces more of this the fat in the fat pad area, and it teaches the body. It basically teaches the body to continue that, so they don't have to come back and do this over and over again. Because I think a lot of people are concerned that if they do something like this once, they're going to have to come see you every month or every 6 months to kind of re-up on it. So, that's not the case.
So that's the thing, as physicians, we research and we advance, and every year something new comes out. So like me, I used to use Juvederm for people that used to have a lot of pain on the balls of their foot or like the tip of their toe or something that was like driving them crazy, and they didn't want to wear softer shoes, So I used to give them that injection, and it would last them for like 8 months, but then, the body would get rid of it. Okay. Yeah. What this is really, like I've switched for the past probably couple months to this product just because I've had amazing results. And then basically what it does is it makes your body form more fat in the area that's missing fat. So, and the fat doesn't go anywhere. It stays in the fat pad. And my patients are really happy. They have no pain. I have been doing it a lot in the elderly population. Those people who just like, they want to go to the gym with their friends and silver sneakers and all that kind of stuff. And they just have that one spot that hurts. And then I fill up that spot with the fat, and that's it. As far as the procedure goes, it is invasive in a sense that it's an injection, but I make it nice. I prep the area. I numb up all the nerves that lead to the area I'm injecting. Okay.
So no pain then with the injection.
Yeah. And then minimal. So once I do a local injection, once the whole area is numb, I go straight into the fat pad of concern, and I just fan the Leniva or the fat pad, the juice. I like to call it the juice. Okay.
The juice is loose.
It's really cool. It's like a syringe with fat and stem cells. So I inject it, I fan it in to all the planes of that fat pad, and it just sits in there and does the work. And within 12 weeks, the magic happens. So it works. I like it. A lot of people have this pain. It's also, meant for people who just destroy their feet doing sports, and they don't, if orthotics aren't cutting it, if the shoes aren't cutting it, if they just have that one spot. A lot of times people have a limb length discrepancy, like one leg is longer than the other, and they have just one joint that's sticking out because that leg is longer or shorter. And instead of changing their shoes and making all these orthotics and they're sick of it, they will come and get that fat pad injection just to alleviate the pain, so they don't have to always come and do all this other stuff, pretty much.
It's interesting. I had a thought. I've heard obviously of stem cell injections,
Mm-hmm.
but I've never heard of mixing the stem cells with other types of cells. Is that something common in other treatments as well? Or do they do straight stem cell injection? Like, what's the difference between, I'd imagine that doing the stem cells with the fat cells, it's going to take better to the area because it's a fatty area. But there's also scenarios where you just inject straight stem cells into an area. Like, what's the difference between those two things?
So I actually use another product called Restoragel, and that is a straight stem cell. It's stem cells harvested from the umbilical cord of the baby. They're safe. It's donated. It's great. It's legal. Wonderful. But what the stem cell does, what those things do is it's regenerative medicine. So so what it does, it regenerates the area. So if, let's say, a patient has a sprain or a chronic tendinitis, right? Or they have a lot of scar tissue in some area of their foot or their ankle or their leg. So what the stem cell does is it regenerates the tissue. It forces the area to kind of rebuild itself. Not kind of, it rebuilds itself. I've actually used it for an Achilles tendon tear a couple of times. And it, I actually have saved patients from surgery. And what it does is it stimulates the healing in the area so that the area can heal. So it's regenerating tissue. Does that make sense?
It does.
So now Leniva, it takes that same science and then it mixes it with fat, and then all these components that they mix with that fake fat, or not fake, it's donated. I don't know where they get it from, but it is harvested. They harvest it from somewhere, and it's safe, and it's like a legit company, and I really, really like them. So I mean, they get it from somewhere, and then all these special factors that they mix it together with it creates that regeneration of the tissue. So usually, like if I inject it into an ankle sprain, so it's going to regenerate the ligament. If I have like my stem cell injection, patient has an ankle sprain or like a tear of their ligament, I inject it there, so it makes your body regenerate that ligament or that tendon. Okay, where Leniva comes in for the fat pad augmentations, it's already pre-mixed with fat cells and the stem cells, and I put it locally to the problem area, and its job is to regenerate or augment the fat in that area.
How do you determine the appropriate amount of actual injection to put? Because I can imagine, like, if your fat pad is worn down completely, you're gonna put more in there. Like, how is it a standard amount across the board? Does it vary per patient?
The standard amount is 1.5 cc's, which is like half a syringe. Okay. Like that. So that company uses it for other things that they need more for. Like I think you heard that guy speak. He was saying, for breast augmentation to give them a lift. For those procedures, they need a lot more.
Yeah, I'd imagine.
For people that are like fixing things in their face or like in their breasts. For the foot, you really don't need more than 1.5 cc. It's about this much, and because your foot's small, you don't need that much. And then the fat pad, like I would say, like if the heel pad, the regular heel pad is probably 6 centimeters in diameter, so you really don't need much. And it's not pain. It's a painless procedure. There's no pain after, it's just, it sits in your foot and it does the magic.
Are there any tips you can give to anyone out there? I mean, is this something that you should even be concerned about? It sounds to me like if you have this condition over time, you become elderly, it's pretty simple to just come see you and have the injection. But is there any like tips you can give, generally speaking, to prevent these issues from happening in the first place in terms of like common footwear or whatever it is?
So the number one thing is footwear.
Sure.
If you wear supportive footwear, especially in the elderly, they're the ones that lose the fat pad first, right? So the only thing that helps with their pain before they come to me for this type of injection is wearing soft insoles. So they wear like the soft insoles in their shoes, the silicone insoles, any like soft foam and padding that helps prevent pain. But if they were younger, before that would happen, I would have told them to wear really good shoes and orthotics. And it's very important to take care of your feet. Like a lot of people neglect their feet. It's there are like products and massages and things like that they encourage collagen production in your foot. So that's also very important for prevention. So like if you're female or male or whatever, you really should get like a foot massage once in a while. You should soak your feet in Epsom salt soaks, when you have a chance, and really just taking care of your feet, wearing the right shoes, and letting your feet rest. It's probably the best thing you can do to prevent fat pad loss from happening.
All right. Anything else you wanted to touch upon before we wrap this one up?
Not really. I have just all I want to say is, I love science and there are awesome products out there, and I get really excited, when I find a great product that can help my patients. Surgery, no surgery. So this is, some of these things are pretty cool, and I can't wait to help anyone with any of these issues if they need me.
You hear that, everyone out there? If you're suffering from any kind of foot pain, or heck, even if you're not suffering from foot pain, but you haven't gotten checked out in a while, reach out to Dr. Debakroff. She's doing great work. Just fantastic stuff. That's all. I'm speechless. What can I say?
You speechless? Never.
No.